Communication. It is the process of reciprocal exchange, not only of information, but it also includes the ideas, beliefs, and attitude. To Koshir, he said, communication promotes mutual understanding and it establishes the constructive relationship between the nurse and the client. And this will lead us to the topic discussion of this week. Let's try to know what a process is. It is an observable communication component, such as the behavior and the sound, which is accented words. Let's try to distinguish between what is a content and a context. When we say content, these are the literal words when a person speaks, and context would be the environment where the communication occurs, such as the physical environment, the social, the emotional, and cultural environment. Let's as well try to distinguish between what is congruent and incongruent message. When we speak of congruent, the content and the process agrees. And if it happened to disagree, then we will have an incongruent message. The therapeutic communication. This is an interpersonal interaction between us, the nurse, and the client, intended to promote an effective exchange of information. It is said that establishing a therapeutic communication is one of the most important responsibilities of a nurse when working with the patient. In therapeutic communication, the nurse will direct the communication towards the patient. That is in order to identify, number one, the current health problem, the plan, the implement, and evaluate the actions that the nurse has taken. The forms of communication. Generally, there are two forms, the verbal and the non-verbal. We say it's a verbal if it is consistent of words a person uses to speak to one or more listener. We call it messaging by words. And non-verbal if the behavior accompanies verbal content. We call it wordless messaging. Further, when we speak of non-verbal, this is exhibited by body language, eye contact, facial expression, tone of the voice, speed, and hesitation in speech, such as grunts, groans, and the distance from the listeners. Proxemics. This is the study of distance zones between people during communication. And there's what we call the zones of personal space. As you may see in the picture, there will be varying colors representing different distances of proxemics. And there are zones of personal spaces. We will try to define it. These are the intimate, the personal, the social, and the public zones. When we speak of the intimate zone, this is about 0 to 18 inches and usually being utilized by the parents to children relationship. But this is also necessary for nurses for holding a crying infant when nurses are doing physical assessment and when you are about to bathe, to groom, to dress, and feed the patient. Intimate zone is important for us. The personal zone as well. Personal zone is between family and friends. That is from around 18 inches to 4 feet. Well enough to talk to friends and families. Sitting at the client's bedside is one of the application. Taking a client's nursing history, we utilize personal zone. And when we exchange information during change of shift. When we talk about social zones, it's 4 to 12 feet. This is appropriate for social, for work, and for business. When physicians are making rounds, sitting at the head of the conference table, and when you are teaching a class and conducting a family therapy. And finally, the public zone is the longest, the farthest, 12 to 25 feet and greater. This is utilized in a scenario where there is a speaker and an audience in a hall, usually. Speaking at a community forum. So these are what we call the proxemics, and these are what we have to observe as a nurses. The nurse-client communication. Having mentioned earlier the meaning of therapeutic communication, it is where the nurse directs the communication towards the patient. And this is done intentionally to identify the current health problem, the plan, and how to implement it and evaluate it later. The therapeutic communication is a process in which the nurse consciously influences the patient. It helps them in a better understanding of verbal and the non-verbal communication. Now, at this point, let's try to distinguish between what is a therapeutic communication and a non-therapeutic communication. There are so many phrases and words where we could use to describe therapeutic communication, and there are a lot to discuss. We may say that therapeutic communication is a collection of techniques. We will prioritize the physical, mental, and emotional well-being of a patient by using this therapeutic communication technique. And we call this technique as a tool that will provide us the holistic means of patient-centered care by respecting the boundaries and empathizing with the patient. So therapeutic communication later on will be discussed with great emphasis. Now, when we speak of non-therapeutic communication, this is being comprised of words, phrases, actions, and tones. However, there's a big difference between therapeutic and non-therapeutic. If therapeutic is a healthy communication pattern, then non-therapeutic would mean the patient will feel uncomfortable. And thereby, when the nurse is not conscious of what he will be saying, it can bring stress to the patient. And worse is that it can worsen the mental and even physical well-being of the patient. So for short, non-therapeutic communication is not relating to or being, or non-therapeutic is not providing any therapy. It is not therapeutic. So let's proceed with the discussion of therapeutic and the non-therapeutic communication in details. Accepting, a therapeutic communication technique that indicates reception and affirmation. It will signify that the nurse has heard and followed the train of thought of the patient. In this scenario, you may see that the nurse is talking to patient Joel, who is seated right in front of him. Let's take a look and listen as to what the nurse will say. Yes, I understand. I will follow what you said. This communication will signify that the conversation is clear enough, yet it doesn't necessarily mean an agreement, and this is non-judgmental. Likewise, the non-verbal expression of the nurse must be there and must coincide, such as the tone of the voice, the facial expression, nodding, the eye contact. For this will convey even more acceptance and will make the words even more meaningful. In the end, the patient will feel, therefore, that the nurse is listening to her, and likewise, she will become even more receptive, and she will take the nurse seriously, and this is accepting. Broad openings. This is a therapeutic communication technique that will allow the client to take the initiative in introducing the topic. It is said that conversation is most effective when the client directs the flow of conversation, meaning he must be the first to decide as to what to talk about. And broad openings is a good way to allow the patient an opportunity to discuss what is on his mind. And this scenario, you may notice that patient Julio, at the right side seated, is hesitant about talking. He is reluctant and he is shying away and is skeptical on what to say and how to say it. Now, at the left is the nurse. Let's try to look and listen as to what the nurse will say. Is there something you would like to talk about? Where would you like to begin? In the end, broad opening may stimulate him to take an initiative to talk, and broad openings is a therapeutic communication technique that stimulates him to do that, and everything follows. Consensual validation. This is a therapeutic communication technique in searching for mutual understanding for accord in the meaning of the words. For a verbal communication to be meaningful, it is being said that it is essential that the words to be used must have the same meaning for all the participants, and that in this case, it will refer to the nurse and to the patient. Let's take a look and listen as to what the nurse will say in order to use the consensual validation. Tell me whether my understanding of it agrees with yours. Are you using the same words to convey that? In the end, he can never be misunderstood. There will be a mutual understanding all throughout the therapeutic nurse-client relationship. And this is consensual validation. Encouraging comparison. This is a therapeutic communication technique done by asking the similarities and differences during the conversation. Here, the nurse is trying to compare ideas, experiences, or relationship being brought about by the many recurring themes. The client may benefit from making this comparison. In this scenario, the nurse is at the left side and will be trying his best to communicate with the patient by encouraging comparison. Let's take a look and listen as to what he will say. Was it something like what you have experienced before? Have you had these similar experiences? In the end, this therapeutic technique is geared towards recalling the past coping strategies or coping mechanism that seem to be effective for the patient in order to renew his strength or in order for him to survive that similar same situation. And this is encouraging comparison. Encouraging description of perception. This is a therapeutic communication technique done by asking the client to verbalize, or that is to speak up on what he sees or hears or what he perceives. This is done to understand the client. The nurse must see things from his or her perspective by encouraging the client to fully describe the ideas that bothers him. At the left is a nurse who will be trying to encourage the patient to describe his perception. Let's take a look and listen as to what she will say. Can you tell me why you feel anxious? What is happening to you? What does the voice seem to be saying? In the end, the nurse must help the client be relieved from tension or to what the client is feeling. The client must be less likely to take an action on ideas that seem to be harmful or frightening him. And this is done by a therapeutic communication technique called encouraging description of perception. Encouraging expression. This therapeutic communication technique is done by asking the client to appraise the quality of her experiences. You will be seeking for the expression of the clients. The nurse will ask the client to consider both the people and the events in the light of her own values. The nurse is at the right side looking at the patient and will try to encourage the patient to express and to encourage her own ideas. Let's take a look and listen as to how will the nurse do this. Patient, what are your feelings in regards to the phobia you're experiencing right now? Does this contribute to your distress? In the end, the nurse will encourage the client to make his or her own appraisal rather than accept the opinion of others, from which her expression will be valuable in the process of her treatment. And this is a therapeutic communication technique called encouraging expression. Exploring. This is a therapeutic technique being used by the nurse if the client expresses an unwillingness to explore a particular subject, or the client might be unable to tell a whole story. When the client deals with the topic superficially, exploring can help them examine the issue more fully. Let's take a look and listen as to how the nurse will try to explore the ideas and the topics to the patient. Can you tell me more about that? Would you describe it more fully? What kind of work are you saying? In the end, it will be better to explore the subject matter, or a concern can better be understood if it is being explored in great depth. However, in the process, we will be maintaining respect to the wishes of the client, and exploring will be very helpful to the nurse as a therapeutic communication technique. Focusing. A therapeutic communication technique used by the nurse in order to encourage the client to concentrate his energy into only a single point. It is possible that the client may have an overwhelming problems or a lot of thoughts passing by to his mind. He may have a multitude of factors. However, the nurse must try his best to tell the patient to focus. Let's hear from the nurse as to what he will say and how will bring the patient to focus. This point seems worth looking at more closely. Can you focus on that? Of all the concern that you have mentioned, I think we should talk about this. Which is most troublesome of all that you have said? In the end, the nurse has utilized focusing technique if the client or when the client turns to jump from one topic to another topic and another topic. At this point, focusing as a therapeutic communication technique will help the nurse and the patient to concentrate on one single point of idea within a discussion, and this is focusing. General leads. This is a therapeutic communication technique used by a nurse in a situation where the client is hesitant or uncomfortable in a discussion about a particular topic. Here, general lead indicates that the nurse is listening and the nurse is following the client as the client is saying without taking away the initiative for an interaction. Now, let us pay attention as to how the nurse will do this, saying the general leads in the middle of conversation. Um, Patient, go on. Tell me more. And and then what happened? Patient, can you tell me more about it? I'm excited to know. In the end, general lead is a form of encouragement to the client to continue talking, an initiative for interaction, and general lead is there to make the client verbalize and take a direction in the conversation. And that is general leads. Formulating a plan of action. A therapeutic communication technique used by the nurse in order to ask the client to anticipate or think in advance of a particular action or a solution that is appropriate for him to do. Let us take an example in order for us to understand formulating a plan of action. If a client at the moment experiences severe depression, then the nurse must ask the client as to what would be his plan of action if such depression attacks him again. Then the client may formulate an action. Action can be to verbalize their emotion to the nurse, or either to go out and mingle with friends. Now, let's check it out as to what are the possible questions of the nurse in order to formulate a plan of action as a therapeutic communication technique. Here's what she will say. Patient, what could you do to let you anger out harmlessly? Patient, next time this situation happens again to you, then what would you do? Patient, what might you do to handle your feeling of jealousy if it attacks you? Formulating a plan of action is a therapeutic communication technique used by the nurse by asking the client to consider the kind of behavior likely to be appropriate in the future situation. This is formulating a plan of action.